New Mexico hospitals are nearing crisis mode tonight. ICU beds are full. There is a nursing shortage, and COVID cases continue to rise. News 13's Rachel Knapp is here with an update from top state health officials. Rachel.
Dean, at last count, 50 people are on a waiting list for a bed in the ICU. COVID is partly to blame, but people are also seeking care they had delayed last year. And state health officials say it's only going to get worse if people don't get vaccinated.
The importance of the actions we take, not just for ourselves, but for our whole community.
Dr. David Scrace is calling on New Mexicans to get vaccinated. In a press conference this afternoon, top health officials shared their concerns about the uptick in hospitalizations.
ICU beds nationwide are filling up.
In New Mexico, we're almost into the crisis level standard of care at hospitals. That means if things get worse, hospitals could be forced to make decisions about who gets what resources and care because staff is short and beds are limited.
Our ICU beds in the state are well over 100%, with the ICUs in Albuquerque, Presbyterian, and the university in particular expanding well beyond their capacity to take care of extra people.
Dr. Scrace says the ICU bed shortage is statewide, especially for people needing them in Albuquerque, Farmington, and Las Cruces.
We have over 50 people right now just on a waiting list to get ICU care.
To hit home, officials shared several graphs showing the difference in hospitalizations and case counts comparing the vaccinated to the unvaccinated. They say unvaccinated people have made up 88% of hospitalizations and 85% of deaths this past month.
The green line, which I'm pointing at there with a large red arrow, is the case rate among unvaccinated persons. And this is very quite worrisome.
Although New Mexico's largest population is in the metro, officials are looking to the northwest and southeast as areas of concern. The southeast is the biggest worry of all. They're approaching 280 cases per 100,000 people per day. That's a 5 times higher rate than in northwest New Mexico. Officials also point out the low vaccination rate in the southeast, which is around 45%.
We've seen case rates in the hundreds in both Eddy and Lee counties, meaning that 0.1% of folks in those counties. That's like every 10 days, 1% of the population will be infected. And that we've not seen those kind of rates in a sustained fashion ever in the history of this pandemic.
Dr. Scrace predicts daily COVID case counts statewide could climb to 1,300 to 1,500 by next month. Back to you.
Okay, Rachel, thank you. Dr. Scrace says there's a possibility we could see a downturn in cases in mid-September, but that depends on people wearing masks, he says, and getting vaccinated.